the thumbs up, and so we're going to go ahead and start, even though others may join us as we're going along. Good morning, everyone, and welcome. Thank you so much for joining us this morning. I'm Laurel Holmes, and I'm Director of Community Partnerships and Population Health for Westerly Hospital, part of Yale New Haven Health. And I would like to welcome each and every one of you for joining us this morning. If you haven't done so already, please introduce yourself in the chat so we have a sense of who is with us this morning. Healthy Bodies, Healthy Minds is an unprecedented collaborative effort to transform the health of our community in one of the state's 10 health equity zones. Through Healthy Bodies, Healthy Minds, we envision a Washington County where everyone has an equal opportunity for a healthy life. And our mission is to advance the health and well-being of Washington County residents through collective community action to address disparities. This work requires many collaborative partners, and we're so fortunate to have all of you joining us and many of the organizations and people that have been involved in this work. It goes without saying that this has been an extraordinary year and that it has tested us all. People and organizations in Washington County rose to the challenge, coming together in new ways to address the needs of our communities, and we're so grateful for all that you have done. Given the toll of the pandemic, we planned this convening with the theme of reconnecting and re-energizing, such as it is in a Zoom format. Our goal today is to foster connectedness among us and update you on Healthy Body, Healthy Minds, many efforts and initiatives. And we're so pleased this morning to have Christine Runyan present to us on the topic of maintaining and promoting well-being in the pandemic and beyond. And so I'll do a brief introduction for Dr. Runyan, and then she will take us on the journey. Christine Runyan is a clinical health psychologist, professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School, and co-founder of Tend Health. After starting her career as a psychologist in the U.S. Air Force, she focused on her research on clinical service and teaching on behavioral science in family medicine, as well as promoting models of integrated primary care. Dr. Runyan is also a mindfulness teacher at the University of Massachusetts Center for Mindfulness. At the height of the pandemic, recognizing the undeniable need for expert mental health services for healthcare professionals, she launched Tend Health, which provides specialized, private, and accessible mental health care and education to healthcare professionals in consultation to healthcare organizations willing to invest in their most precious resource. Before turning things over to Christine, I would ask you to put any questions you may have in the chat function, and I'll be watching that along with Danielle for your questions. All right, and so now I'm going to kick it on over to Dr. Runyan.
Thank you, Laurel. Thank you for the warm and kind introduction, and to Susan for the invitation to be here with you all, and really just a deep bow of gratitude for all of you in advance for your attention and for all the work that you do. So I'm going to try to talk a little bit about how to maintain and promote well-being in the pandemic. I love this tagline of an equal opportunity for a healthy life. And some of what I'll be talking about, while it is true that things outside of our individual experience vary so much, I'm going to be talking a lot about what is true and common and available really to all of us, because we all sort of have the same source code as humans. And so this really is available to all of us, regardless of what's outside of us. So I'll just start by recognizing that, you know, this is still a little bit of where we are, that we want to make a lot of predictions and have some control and a lot of knowing over what's going to happen in the future, because that helps to settle us. But the truth is, we still have a lot of questions and a lot of unknown. So I want to take us on a little journey of what that does within our bodies and in our systems to help ground some of the recommendations that I'll make about how to meet this moment and how to meet each of these moments. So I want to start with providing a common language and foundation for what's actually happening for us as the animals that we are, really the creatures that we are, and what's happening underneath the skin. So I will kind of have a short window here, and so I will talk fast, but I do welcome questions and dialogue. So I want to start by just grounding us with this understanding of stress and what a stressor is. And also frame this that that's not always a bad thing, but we have to understand what's happening in our interaction with stressors. So stressors could be things that are outside of us. Stressors can also be things inside of us. If you've ever had, well, many of us have some kind of illness, right, acute or chronic, that is a stressor to our system. But stressors can also be outside of us. Stressors can also be completely conjured up in this beautiful mind that we have, that they can be a thought stressor or a psychological stressor, not even necessarily something tangible that we can, or concrete that we can point to. So anything that activates a stress response in us is a stressor, and those can be acute, chronic, like I said, physical or psychological. And stressors aren't bad. Stressors aren't inherently bad. Our system is actually quite well designed and needs some kind of stress to activate us, to help us perform at our best, to get us into a state of flow. We all actually, as humans, do well with a little bit of pressure introduced to our system. It's what got people out of bed this morning and got people here on time. It's what got me to make this presentation. So we all benefit from that in terms of our optimal performing. However, we all of us as humans also have a tail end to this, where when the stress is going for too long, too intensely, or too frequently, we're met with all of these stressors, we all develop some end system strain, and we get into that place where our performance really suffers under it. So I want to just frame that stress isn't inherently bad, but our systems are exquisitely designed to pick up threats and the perception of threat that is novel, that is unpredictable and uncontrollable. And if you think about what we've been through for the past 14 months, here it is. Here it is on a platter. Coronavirus is novel. It felt incredibly unpredictable before we started to get a toehold and some tactics that we could leverage and some understanding of how this was going to unfold in our lives. But for a lot of that, it felt very unpredictable. As humans, we are wired for safety and survival, and we are wired for connection. So the reason this particular threat was so pernicious for all of us is because it actually sent us all scattering into our individual squares, right, into our individual zones. And that really is so counterintuitive to how we are wired as humans. When our system perceives a threat, when this stress response goes off, it is a cascade that is predictable and that is common in each one of us. We all have the same effects that happen in our system. So the threat, this, if you will, is detected through our sensory experience. So through what we see, what we hear, maybe what we taste, what we interocept in our touch, or at the level of our skin. So our senses are taking this in. It's not all of what we are thinking we are perceiving, but what's actually being perceived by our system. This is an autonomic and automatic response, and thank goodness that it is. It doesn't require us to sit in deliberation and analyze whether something is actually threatening to our survival. It just kicks in and says, oh, here's a potential threat. Let me activate the system. It does through a couple of hormones, norepinephrine, adrenaline, cortisol. Those get released into our system instantaneously, and a cascade of things happen. Our heart rate increases, our blood pressure increases, blood diverts to our major muscle groups, our clotting factor increases, so that if we get hurt, we're less likely to bleed out. We might get sweaty, so that we're slippery. So it is this, again, this beautiful adaptation of design, except this response can activate for things that really aren't threatening our survival imminently. So we have a really active part of our stress response that lives in this small part of our central nervous system in our brain called our amygdala, buried deep within there. And that's our threat appraisal system. It's also where aggression is housed. And when that system goes out and says, threat, fear, scary, this will happen whether there's a real threat or not. And the connection from that part of our brain to our thinking part of our brain, our prefrontal cortex, is there. But for most of us, unless we really have been working this relationship, it's fairly weak, which means it takes a little bit for our thinking brain to kick in and say, oh, that was a car backfiring, it's okay. Or, oh, yes, I'm around people, but I have my mask on, maybe even now, and I'm vaccinated. It's okay, you can settle. It takes a moment for our thinking brain to kick in, because what happens in our stress response is that our thinking brain goes offline. Our thinking brain is actually impaired and compromised when our threat response is going off, because we are creatures that have adapted this way, because we don't want it getting in the way. We don't want it sort of exerting its seemingly great power to analyze a situation. And so it's designed to say, don't think about this, we'll process it later, just react at a creaturely level. And that's so much of what we've been experiencing through this time. We all hum around at a level of functioning within our nervous system that is ideally in this optimal zone of arousal. This is the place that most of us are sort of in our happy place. We can tolerate our feelings, we have present moment awareness, we can be curious, we can feel, we can think. This optimal zone of arousal, for all of us, but with anybody with prior trauma, but for all of us during this time period, has shrunken. And so that window is more narrow, which means it takes a lot less for us to activate in a way that kicks off this stress response that may show up as fight or flight, meaning hyperarousal, but it could also show up as being really tucked in, really constrained in the sense of hypoarousal, which is a fascinating state because it's one of very little affective and behavioral function, but a lot of physiological arousal that's going on underneath the skin. And we're all fairly patterned. It doesn't mean you're going to react to to every stressor in the exact same way, but some of us are patterned to go into fight or flight response, and some of us are really patterned to go into an immobilization response. And you'll probably start to recognize that in yourself as, oh, how do I meet stress in my life? And I'm talking about this at a physiological level, but this is what also shows up emotionally, and this is what shows up behaviorally. So emotionally, this hyperarousal zone can show up with a lot of impulsivity, a lot of acting out, feelings of anger, feelings of irritability, a lot of cognitive rigidity, where if sometimes people are generally pretty cognitively flexible, go with the flow, all of a sudden things have to be a particular way. That sort of cognitive rigidity is part of a hyperarousal reaction. I hear a lot of people talk about how they're just much more irritable and much more reactive now. And then in this hypoarousal zone, again, the sense of being really tucked in, sort of feeling a little bit numb, disconnected, flat affect, feeling like you just can't rise to the occasion. And so all of these are manifestations of this stress response. And so they're very normal adaptations to an incredibly abnormal experience that not only is a point experience, but is a very chronic now 14-month experience for all of us. And I think the more we can understand it at this level, starting with ourselves, the more grace we can actually invite for ourselves and for other people, because we can begin to understand what looks like somebody being a jerk really as a manifestation of perhaps their amygdala firing, they're in fear, they are exhibiting aggression, but it's because of that stress response. And so I always like to start close in. I always like to start with people, inviting people to really tune in to how do you experience stress? Because there's a whole cascade of things that can happen, as you'll see on the screen, in terms of what shows up in our body. But we don't often think about the behavioral manifestations or the emotional manifestations or the thinking manifestations of stress. We often think about it really at that stress response physiological level and then sort of going on. But there's a lot of residue that happens when that response is going off. So I really encourage people to get tuned in to like, oh, what's my pattern? How do I experience stress? Because often it is quite patterned in us individually, but it varies within our teams and in our groups and in our communities. And so you'll see this all over the map, but individually we can be pretty consistent a lot of times. And so that's a place where I really like to start encouraging people in terms of well-being, is this sense of self-awareness, which really is a superpower. Because if you understand the manifestation of it, you might not detect in the moment I'm stressed, but when you start where you're like, I'm having a hard time making a decision. Oh, what's happening underneath? What's been going on that might be showing up this way? Because the other thing I know about humans is that we all judge our own experience so much. We recognize something that's not working as well as we would like it to, and then we double down on that by judging our own experience. I'm so tired. Why am I so tired? I can't believe I'm so tired. I wish I wasn't so tired. So all of those, machinations that happen in our mind can actually just, in many ways, worsen the experience until we can see this as, again, a physiological response that shows up in a variety of different ways, not just in our body, but in our minds and in our emotions and in our behaviors. And one of the things that has been so evident for me in this pandemic is that while stress is not inherently bad, we can only get to resilience when we have a period of recovery. And so as you work in your communities and in the jobs that you do, and as you work with yourself, really, to start and to model, to understand that when the stress response is going off, the only way we get to resilience is a period of recovery. And we haven't really had that baked into our experience in mass. And so our bodies are really good at meeting a stress, adapting to that stress, and coming back to homeostasis. And it builds our resilience. It builds our strength. We know this from what we do at the gym. We do some reps, we stress the muscle, it gets stronger with recovery. If we never recover, if we never give ourselves those rest days, we get end system breakdown. The muscle actually doesn't get stronger, it gets injured. But we haven't really applied the same concept to ourselves and our whole systems. And when this happens, you get that allostasis, which we're really well designed to absorb and grow and change, comes into a point of allostatic load that is almost, it's really hard to recover from in the normal ways we think about recovery, right? This is the place of burnout, where you go on vacation for a week and you feel just as bad when you came back, because those kinds of recovery is not sufficient once you get to that point. So I'm all about trying to keep people in closer to this optimal zone in micro practices as best you can. Without that, you get this experience that some of you may have read about in Adam Grant's article in the New York Times, where he's labeling this languishing. And one of the reasons I think people are drawn to this is because it gives us a label and it gives us a sense of understanding what we're experiencing. And when we have a label or we understand it, particularly in a non-pathologizing way, we can settle a little bit. We're like, oh, that's what it is. Right? If we work out really hard and your muscles are sore, you're often not judging yourself for that experience because you understand the mechanism of it. And you're like, oh, this is a good sore. We use that language, right? This is a good sore. But we don't do that so much with our emotional experience to say like, oh, now I understand where this is coming from. So I think when people read about this idea of languishing and it's not pathologizing, it helps to normalize and to give people an anchor on what to hold on to. And that's very much of what I'm trying to do, is for yourself and for people that you're working with to have infinite amount of grace and understanding about what's happening. Because while we have all had a shared experience in this pandemic, we actually have not had the same pandemic. Based on your history, it's been different. Based on the unique demands on you, what kind of job you had. Some of us have been remote. Some have never had a day of remote work, depending on what kind of work they do. We think about people in the healthcare space. They've had a very different experience than some other people. People with school-age kids trying to manage school and home, and other people who have concerns about elderly parents. Some people have had an experience of a direct loss in this pandemic. Somebody really close to them has died, and other people have yet to meet somebody who's been positive or sick when they're positive. So we talk about this pandemic as we're all in it together, and there is this nexus of shared experience, but there is a whole host of other experience that is unique to each one of us, and also why we're not all reacting the same way, because it's not actually the same experience. And even if it were, what we know is that we as humans don't react to the same experience in the same way, right? Some people fight or flight, some people tuck in. So if we can have some grace and not expect people to react in the same way, that can actually be really helpful for us to not be as judgmental, honestly, for other people. And to remember that we are not all operating from the same set of facts and the same truth. We're not actually living in a shared reality. We know this from what's happening in social media and what news and information is fed to us through our little devices or big devices, who we surround ourselves with, and what we pay attention to does really matter. So that's sort of one of my first pearls around well-being, is to begin to separate the behavior from the person, right? We can see Dilbert trying to do this really ineffectively in this cartoon, but it is a gift not only to yourself to separate your behavior from you as a person, right? I made a mistake, not I'm an idiot, but also to do that for and with other people, especially based on the work that you all are doing, going into communities, being in communities, and seeing a variety of different responses, that people are behaving largely out of a patterned way of understanding their worldview that may not be their character entirely. And we have this capacity, when I talk about sort of what is within all of us, we have this capacity within all of us because of the interrelationship between how we feel, how we think, what we do, and what happens in our body. And for a long time, we have really turned away from this experience of what happens in our body as a source of information and a deep, deep well of resilience and capacity that exists within all of us to change how we're seeing things, to change what we do, and to change our emotional experience. And so that's where I want to turn to in our last few minutes here, is this this research study was done by some Finnish researchers who had about over 700 people. They induced some emotional states and people, had them name their emotional state, and then had them basically color in sort of where they experienced this sensation in their body. And so in this graphic, yellow is the highest level of activity, followed by red, black is neutral, and blue is the absence of sensation. And this was a cross-cultural study, and you can start to see where things converge around a shared body sensation experience around particular emotions, because emotions are body experiences. emotions do have these templates of how things show up in our body. And if we can remember that, and we can use that to begin this bi-directional relationship with not just trying to change how you feel, don't worry, don't feel like that, but to work from the body, knowing that working with the body actually can begin to change our direct emotional and cognitive experience because of this mind-body integration that I think is beautifully illustrated through this particular study. So a couple of tips to end with in terms of how do you work with the body. One of them I alluded to in the beginning, which is, eventually your thinking brain, when you have a stress response, will kick in. And if you can name how you're feeling and you can allow that feeling to be there, even if it's unpleasant, unwelcome, and maybe even really unpopular, if you can name it, it may not be how you want to be feeling. I'm really angry that they're doing that. Once you say that, this capacity to name it has this property of diffusing it. But oftentimes we won't allow ourselves to even name it to ourselves. But when we do that, you engage the prefrontal cortex to help regulate, downregulate the autonomic nervous system. So that's a really useful tool. Any kind of long, slow belly breaths can be really helpful. So there's a lot of different breathing techniques that can help regulate the stress response. If I had to point to one that I think is most powerful, it's if you can do inhale and exhale with the belly, but a long, slow exhale. It's innervated with the dorsal part of our sympathetic nervous system, and it's the thing that slows down the heart rate, slows down the breathing, slows down the blood pressure, and turns off that faucet of cortisol and epinephrine and norepinephrine. So long, slow exhales. I do this countless times a day. Again, just to try to change the baseline of my own experience. Anything that grounds you in your body, literally like bum in the chair, feet on the floor. Uncross the legs if you're sitting in a chair, placing your feet on the floor. The body posture of the stress response, fight or flight, right, is a little bit on your toes. The body posture of the stress response is to be in movement, one direction or the other. Feet flat on the floor can send a message through your body around stability, around safety. We're here, it's okay. And that can begin to downregulate the stress response. Now, sometimes what we need to do is discharge energy, particularly if you're somebody that kind of holds this. And sometimes, particularly people who tuck in, they actually need to shake out some energy. And so literally moving the energy through your body, literally shaking it off, tapping it off, moving that energy can be really helpful to downregulate the system as well. Another technique is to narrow your focus to a single point of attention. That could be your breath, for example, if the breath is neutral for you, but it could be sound, it could be a candle, a light, it could be somebody else's eyes. If you recall, the stress response is responding through our senses. And when your stress response goes out, what happens to your senses? You get more vigilant. You get more aware. Your senses say, something's going on here. Pay attention, pay attention. And so your eyesight changes and gets much more keen. You're hearing, all of your senses, so you're taking in more. Well, if there's not really a threat that you need that level of sophisticated response for, your sensory system is just pulling in anything that sort of confirms that experience. So dropping in, narrowing your attention to one thing will give your body a chance to settle. These are all things that are available, again, to everybody, anytime, no matter what else is around you. And then the last thing I would say is, anytime you can complete the stress response to find your ways to recover, to move towards resiliency. Now that differs for all of us. But I will just say, we all know these basic things, right? Social connection, sleep, all the things that have been said, you know, what helps with our well-being. This is the foundational piece that changes the baseline and allows you to absorb the individual stressors. But how we each recover is different. And so this first bullet is also an invitation for you as individuals and for you as leaders within your community. It goes into the self-awareness bucket of, you know, what nourishes you and what depletes you, and being really clear about that, because recovery will happen in what nourishes you. Now, there are things that we can do that we love to do that may also deplete us. It doesn't mean we have to stop doing them. It just means getting really clear about how to bake in that recovery, given your own limits and constraints. Because even if what you do and you love to do, and I work with a lot of people who love what they do and it depletes them, and trying to figure out that balance. So you have to really know what nourishes you. And it doesn't matter if it's different than people in your family or other people, but to know, where does your system actually complete the stress response to recovery? And we may have to do that multiple times a day. Sometimes I have to do that multiple times an hour to be able to regulate. So I know that was a whirlwind of things. I really hope that I was able to plant a couple of seeds of things that might be useful that you can bring to your everyday work. And I know that the work that you all do is just very purpose-driven. I'm sure it is a privilege to do that. It's not always easy. And I deeply thank you for all that you do in this space. I will stop sharing my screen, and I don't know exactly if we have much time for questions, but I'm happy to take one or two if we have some time.
I think we have a couple minutes, and I just want to thank you, Tina, for that inspiring presentation. And I wonder, just to start off questions, if you could say a little about the impact of the loss of touch in this time of social isolation, and how that has, affected the stress response.
Sure. Yeah, I didn't really talk about the other part of our nervous system that is really wired for connection, but it is often labeled the tendon befriend part of our nervous system that is also part of our source code, and it knows regulation and safety through touch. It's why when we see somebody or see an image of somebody who is who's suffering, there's this inclination to, for a lot of people will say, right, to move towards, to touch, to hug. And so it is both an expression of compassion that was taken from us in this pandemic, and it is an expression of empathy where we receive that has been taken from us. And so while it may be less optimal, we can offer some of that to ourselves. I will often put a hand on my heart to tap into that physiology that knows this as comfort, that knows this as a regulation tool and a presence. And so the loss of both, not just receiving it, for many of us who work in this space, the loss of being able to offer that has been so hard, because it's taking away that adaptive part of our nervous system. Yeah.
Great, thank you. I've posted in the chat some other ways to hear you. One of our planning committee members heard you on Being with Krista Tippett, and so that's what sort of led us to you. Does anyone have any questions that they'd like to post in the chat for Tina before we send her off? Well, you've certainly given us lots to think about. I think lots of ways to care for ourselves. I'm particularly struck by your comments about allowing ourselves grace. That's been sort of my mantra through all of this, is just to allow grace for others and myself. And I think it's an important, you provided to us an important reminder of that. So thank you. Thank you so very much.
Thank you. My pleasure. Have a good rest of the meeting. Be well, everyone.
Absolutely. Thank you.
Thank you,
so
Tina.
now we're going to shift gears a little bit, and I'd like to introduce Michelle Gonzalez, who's going to lead us in our next activity. Michelle is with Gateway Healthcare and is a member of our planning committee for this event.
Hi, my video isn't working, but they're going to take care of it on the back end. But basically, this is a coffee chat break. 5 minutes. We're going to be sending you to meet somebody else that's involved in this convening session, and we'd just like you to introduce yourself and what is the work that you do that you love, and maybe talk about what helps you to relax. It's about a couple of minutes, and then the other person can go as well. And this is just a way for you to get to know one person, and then we'll continue and bring you back afterwards. So just click on the join button when you get prompted.
Susan, can you hear me?
Laurel, we didn't put you in a group, if you're wondering.
I was wondering.
Yes, sorry.
It's okay. And I also noticed our participant numbers down to 4. Is that because everybody's in groups?
Correct.
Okay. Okay.
So
I thought something happened. I'm like, oh my God, we
yes.
lost 50 people.
Yeah, no. So they are joining groups. They are in those groups.
Okay.
So hopefully. So it's, yeah, some folks are alone because people jumped off the meeting.
Oh, all right.
So Danielle is, trying to fix that and get people connected.
I see. Okay. All right. And then they'll all pop back in here, right?
Yes. And then, we'll send them a like 1 minute reminder that, and then they'll all come back.
Okay. All right.
So hopefully, fingers crossed.
Yeah. I could have listened to her talk much longer. She was really
so
interesting.
She was very interesting, and I thought gave us some really great tangible things to do. Yeah. And a framework for people to think about this and give both ourselves and other people grace.
Yeah. Yeah, for sure.
Yeah.
Hey, Laurel.
Yeah.
Can you hear me? I was in the breakout room with Vanessa and neither one of us could see or hear each other. So I jumped out. I'm not sure if it says host is still not letting video work. I'm not sure if everyone else is having that trouble.
So
Either Danielle or Susan would have to remedy that because
You might have to go into the participants box and then individually allow people to use their mic. I don't know if there's a global setting for that.
I think there is a global setting, but only the host
host
has it.
name, yeah. So Danielle, Donna, or Susan have host capabilities.
Yeah. Susan was just, I can't see anything because my video is not working either. So
Okay.
I feel like I'm like talking to myself in the dark. But Susan was just on, so maybe they're trying to fix it now. I don't know.
Yeah. I just ended up sending Vanessa a chat, so she's probably in the dark room herself. I'll see if I can go back. I think I can go back into the.
Can you? I didn't know that.
I came in and out once. Let's see if I can do it again.
Okay.
We learn. That's what we do here.
Yes.
No, it said before join room. Maybe we're.
I structured a. Oh, it's not a mistake.
It works great when it works.
Yeah.
So I'm still not on video, but that's okay.
Hi, Gonzalez.
Hey, Jarasoli. All right, coffee chat was successful, I hope. It wasn't enough time, I realize that. So we're hoping that you will have more time to regroup when we go into our breakout rooms later. But first I want to send this over to Susan, introduce our next part of our convening.
Hi, everyone. This is Susan Orban. I am
There you are.
yes, there I am. Okay, great. So I was just trying to share the PowerPoint. I'm having trouble getting it to move. Anyway, I am eager to give you an update on our activities this past year. And so, Danielle, I don't know if this is something you can help with in terms of the convening. Can you see you guys see my screen now?
Yep, perfect.
Okay, terrific. Let's see.
Oops.
Yeah.
Advance the screen.
Stuck again. So I'm gonna just work it from here. And
That's all. We're all gonna bask in grace right now.
yes, indeed. So Healthy Bodies, Healthy Minds was founded in 2015. And it was built around the needs that were identified in the community health needs assessments from our 2 hospitals. And it was designed to be both macro and micro, to both address large population health needs like behavioral health, as well as dive deep on areas in our community with the greatest needs. And we've done that in 3 particular communities, Bradford, Davisville, and Peacedale. One of the things that we set as our common agenda were these guiding principles to help us foster culture change, create enabling conditions, work upstream, and execute resident-informed led action plans. This is our guiding document that we've been using. We have 3 streams of activities: healthy bodies, healthy minds, and healthy communities. We really see ourselves as conveners, connectors, catalysts, change agents, and community engagement is really fundamental to our work. In the last year, we've really had to pivot We haven't been able to make those kinds of in-person connections, and our community needs have been significant. In order to try to help people make and learn about what resources were available and help make better connections, we launched Our Bodies Minds, a community engagement tool that we replicated from Garrett County, Maryland. We also were successful in securing $90,000 in grant funding to help support food insecurity needs in our targeted neighborhoods, as well as COVID testing, vaccine distribution, and health education around COVID. We distributed over 100,000 masks and cases of hand sanitizer, and we began, like many, doing things online, including our many trainings like Incredible Years and Mental Health First Aid. So what have been our accomplishments recently? Well, even with all the work that we've done with COVID, we've continued to do that work in those three streams. And in the past year, 71 organizations have been involved in our work related to 5210. We organized an online school garden conference, and we've uploaded cooking videos and painted hopscotches on playgrounds, all part of that enabling conditions for change. But rather than you listen to me drone on, I really want you to hear from the voices of our partners. And so I'm going to play this video for you. And of course, I'm having trouble with that. So let me pull up.
Try control, click.
From my screen. I did that. I need to, I have them on my desktop, and I just need to get to them. Let's see if I can. Yes, can you? Great. Danielle is going to play them.
Hi everyone, I'm Stacy Zulo. I'm the school nurse for Head Start and Early Head Start in South County, Rhode Island. Particularly this year with the pandemic, it has been difficult to reach and serve families in Buxton. Particularly this year with the pandemic, it has been difficult to reach and serve families, Cindy Buxton, and Healthy Bodies, Healthy Minds. She gave us resources that we could post online and send out to families, like healthy recipes, food resources. She also gave us cookbooks to hand out to families. This is a copy of the book that she created. It has healthy recipes. It has information on how to reduce screen time, how to help kids move their bodies at home and outside, and how to exchange sugary drinks for healthier options. And painted hopscotches with the 5210 logos in each of our playgrounds. That shows the children how to do 5210 every day. And the kids really enjoy them and really use them. And it's really a helpful teaching tool that we use with them on the playground.
We try to teach all children is these special, simple tenets of healthy lifestyle, eating 5 fruits and vegetables, having 2 hours of screen time or less, having 1 hour of physical activity and no sweetened beverages. And certainly the 5 and the 1 are things that we can work on through our school garden.
We at Richmond School, we've just started our greenhouse project. We did that starting this past January. We've got a garden club. It's been growing and growing for probably about the last 4 years.
Agriculture and gardening is considered by many people, oh, that's a sort of a hobby. It's math, it's science, it's history. We're realizing that we need to reconnect to nature, and that needs to be part of the curriculum.
I have been gardening with children for 15 years. I teach K1. We started in early spring, and then, you know, at the end of the year, we have a big salad party. I mean, children will eat their vegetables when they are involved in every step of the process.
Cindy has been an incredible resource to our program, and we have been so lucky to have her.
Stay well.
Okay, so there you heard it. I think you all say it better than I possibly could. These accomplishments are your accomplishments. This is what we've done together. Some of our recent Healthy Minds highlights certainly include the release of our behavioral health strategic plan, which was developed with the voices of people with lived experience. We had a convening this fall to share it with the public, and we've been working on getting it implemented. Another highlight is certainly having now 3 police departments meet their 20% threshold for CIT training for their forces, launching the first survivors of suicide attempt support group, the local police departments receiving a federal grant to continue the police clinician that is part of CIT, and then with our Zero Suicide program, launching man therapy. So Danielle, I'm going to ask you to help again with the video for Healthy Minds.
We all know that mental health is essential to our well-being.
This is a continuum of care. And the problems we're all trying to solve together, they're multifaceted and multidimensional. And so the solutions really have to be multifaceted and multidimensional.
The commonality between physical health and mental health. Mental health is a key to overall health.
This is about changing the culture. Changing the prevailing beliefs, the norms, and the values that we, both professionals and our communities at large, hold about behavioral health. I am especially excited about 3 initiatives we're working on in this area to positively change the culture around behavioral health. One is a new 8-week support group for suicide attempt survivors that I help to co-facilitate. The second is called Man Therapy, and it's an initiative to engage working age men age 24 to 54 in behavioral health care. And that's being spearheaded by Dr. Rob Harrison. And number 3, a new campaign being led by the Charahoe Youth Task Force, where beautiful wooden signs with QR codes are being placed in remote areas where residents have been known to engage in high-risk behaviors and attempt suicide.
Hi, I'm Liz Gledhill, and I am the CIT coordinator for Washington County. And CIT started back in 2019. It came about because the Behavioral Health Planning Committee down here in Washington County looked at our crisis system and tried to figure out how we could improve it and how we could close some of the gaps that are within it. And one of the solutions they discovered was that crisis intervention teams could really help elevate the crisis system and the healthcare community down here. Overwhelmingly, the feedback has been so positive. We've really seen a change and a shift in police culture in these departments. We always say CIT is more than a training, because it is more than a training. It's a framework, and it's a holistic approach to look at your whole department and how you approach mental health calls.
My name is Elwood Johnson. I'm chief of the Richmond Police Department. I can tell you that the officers we've had trained in CIT, that first class in October 2019, it was fantastic, and the feedback was immediate. It comes down to treating people with dignity and being effective. My goal is that every police officer here that works for us, and I know that this is the same mindset of our partners in other parts of South County, Washington County. We want to establish a rapport with the people that we serve so that they know they can trust us, and they know that our best intentions are for their well-being.
But I also see Washington County's plan as the kernel in which we may be able to resonate iterative transformation. So as Washington County goes, so will the state of Rhode Island. So will the New England region. So will the country.
So as you can see, you all have been busy, and there's certainly a lot of great work going on by our partners in the area of mental health. And so, what about healthy communities now? So again, quite a few. Bradford, they were able to launch a food pantry. In Davisville, they established an online community for middle school youth. In Peacedale, the Peacedale Leadership Council, which has been meeting for several years, really helped empower the voice of some of the residents. And one was elected to the school committee, others were appointed to the Housing Authority Board. It's just been great to see the residents develop and elevate their voices and their leadership. And so that's been wonderful to see. Also, over 60 youth went to camp, and 9 had internships or served as counselors in training. And the community health workers were vital in the midst of COVID and helping families, whether it be accessing food or accessing internet for students to complete their schooling. And we also hosted a race equity training in partnership with the Rhode Island Foundation. But again, I want you to hear from the voices of the people actually doing the work. And so I'm going to ask Danielle again to share the little video that Dan Fitzgerald, one of our partners, helped us put together.
All together. To me, community is that we're all together. It's all about teamwork, about friendship. It's where we live. The Davisville Challenge is to boost people up and be as happy as healthy as we can be. Caring for yourself lets us help others. It's simple. Take care of yourself, body and mind. Go at your own pace and do what you can. The better you are, the better we are. Join the Davisville Community Challenge.
I'm Allie Felicetti, and I'm a community health worker for Bradford with Westerly Hospital.
Hi, I'm Autumn Carvalho, and I am a manager at the Food Pantry on the Lane here in Bradford, Rhode Island. We started this food pantry just last year in the middle of the pandemic at that, because we really recognized such an incredible need for the community to have just the basic essentials like food.
We met Autumn once at a community event that I had held, and then a few months later, when we were kind of talking about maybe opening a food pantry in the area because it was a need that we had seen in the neighborhood, I spoke with Pastor Mark at the Joy Fellowship Church to collaborate on the pantry, and he told me that he had the perfect person to get involved with it. And so then he reintroduced me to Autumn, and we started, collaborating on, getting everything set up and putting it all together.
We're all people. We've all probably had a need like this ourselves. I know I have. And we just really want people to feel welcome.
Hi, I'm Magni Gomes from John Cake Center of Hope in Peacedale. I'm a community health outreach worker. Well, over the pandemic, we have reached out to 3 times more individuals as well as families in the community needing food, especially fruits and vegetables. Working in the community, you run into many different types of families and different situations. One that stays in my mind, and there are a few, was a single mom and was actually homeless and was living in a hotel. So took upon myself to go and beyond and work with a few other agencies and try to apply for housing and walk them through the process. And just trying to ensure this individual and that they're not alone, and just also teaching them how to advocate for themselves and their families. And now this family is actually in a home, no longer in a hotel with their children, and they're going to school, also able to set the kids to camp so they can keep themselves engaged in activities as well.
Okay, so back to the PowerPoint. So one of the things that we realized was that in order to make the kinds of changes that need to happen in communities, we really need to be working on policies and getting back to those enabling conditions. It's something that we've been doing as opportunities arise, but we felt it was important that we develop a policy platform. And so we developed a platform in line with our 3 pillars. So these are the areas that we are pursuing in terms of policy change related to healthy bodies. And these recommendations all come out of the work of the 5210 work group. And they relate to really making healthy eating, setting high healthy eating standards and really promoting opportunities for physical activity and being able to live that 5210 lifestyle. So it includes things like ending false breakfast advertising aimed at students, setting high nutrition standards for school meals. Last night, one of our steering committee members was testifying at the sweetened beverage tax bill that's before the legislature. And then also increasing opportunities for physical activity. In terms of healthy minds, the work that came out of our strategic plan, it was clear that mental health needs to be a priority, and that people with lived experience can advise us best on this and what needs to be done. And so we really need to make sure moving forward that whatever we do, there's nothing about us without us, that their voices are at the table and helping guide and drive our work. And then lastly, we need to promote every opportunity for early intervention and identification, which we're doing with zero suicide screening and mental health screening in pediatric offices and so forth. And then lastly, in terms of healthy communities, we really need to work together to eliminate systemic racism and socioeconomic disparities. Certainly affordable housing is a need that we're all aware of and that everyone should be entitled to. We need to make sure that all of our children are graduating from high school, and that if we've learned anything from the pandemic, it's that we need to be connected, and we need to work to decrease isolation and increase that community connectedness. So that's our policy platform that we are going to be pursuing in years to come, and have already begun to work to bring about policy change. We have 2 volunteer advocates and lobbyists, Haley Bates, who is a member of Swell and the youth group that there, as well as Michelle Garasoli. And so it's my honor to introduce Michelle, who is going to lead us in our next breakout. So Michelle.
Hey, everybody. Hey, there I am. Nice to be with you. Thank you so much, Susan, for putting this together and for all the work that you do to lead this community effort of heroes, health heroes. So this has been a great day. And if we were all in the same room together, we would split out into different tables and talk about topics that matter to us. And since we're on Zoom, we're going to attempt to do it in breakout session. As Michelle said before with the coffee chat, there were topics that might have been of more interest to you and the work that you're doing in the community. And so we're going to attempt to split into three, was it 3 rooms, Susan, or are we going to do more than 3? Because there's a lot of us.
Yes, no, we about 5 groups.
5 groups, okay. So what we have to make sure we do this time, because I was locked out last time, have Danielle allow everyone's video and audio. So as host, Danielle, if you can unmute everyone and allow video outside of the panel, that might take a little bit. And then we're going to split into groups. We're going to share kind of what resonates with you from today. The question that we're giving you is, given the inequities laid bare by the pandemic, the focus of Healthy Bodies, Healthy Minds in our policy platform, how do we deepen our shared work to achieve our goals and improve the health of the community? So in your group, how do you deepen your shared goal? So share a goal and see what magic happens between the group. Your group moderator is going to attempt to capture the magic, and then we're going to come back for a few minutes afterwards before we end at 10:30 and share a little bit, but then we'll go, the steering committee members in the rooms will go a little bit deeper and try to capture some of the notes and then share that out with you in an email afterwards. So it looks like everyone's ready. Danielle, are you ready to send us off into our rooms?
Yes, so one thing, Michelle, is that everyone needs to unmute themselves. So you're going to have to look down in your left lower corner to turn your camera on and turn your microphone on. And hit that join button so you can join the group.
All right, let's.
Oh, great. Yeah, I mean, they've got, so many people in the groups. Okay, okay. something sad. Blanking out there. Me too. So they're saying video not working. That's okay. You can't go. See the yes. Just want to cry. Quarter after, 20 after. In a minute. minutes. 3 minutes. Yes.
So we needed 2 more minutes, but looks good.
All right, everyone's coming back from the breakout rooms. We've had our coffee, we've had our chats. I made some notes on the back of my coffee mug. Nice to see everyone. I'm gonna see, I don't think that I can, oh, I can share my screen. I'm gonna share a Jamboard that I collected that I've been trying to capture the magic of our event today, and this will build on. Thank you, Tina, for that presentation. I grabbed a few images from your slides. I hope you don't mind. If we don't have permission, I can take them down, but this was, you know, our goal. These were our policy platforms for healthy bodies, healthy minds, healthy communities, and we will share the learning that we had today, but I wanted to go out to our 3 voluntold people, Michelle and Bettine, and just pick up 2 or 3 nuggets that you heard in your breakout session. I'll start with you, Michelle, with Healthy Minds.
Sure. I mean, we didn't get a chance to introduce all of ourselves, but we spent a lot of time trying to connect. And there was a longing to really understand each other, to find a way to continue the conversation. And so I'm going to just put this out in a little bit for my group, but I would love to follow up with a conversation with you and figure out how we can share resources and contacts. And one of our attendees was a practitioner, and one of the things that she didn't get to share was how mindfulness really is for everybody. Most people think of it as an esoteric practice, but we all, I mean, all of our moms, she specifically focused on moms, could use not just extra daycare and camp, which a couple of our attendees also were offering, but also ways to find peace and understanding. So it's interesting because we keep thinking about screenings and getting people treatment. And one of our attendees was also talking about educating practitioners to also take on this idea of no health is without mental health. And so how can we all embrace this is what we were thinking. It's not just the therapist's job or the doctor's job.
That's great, Michelle. Thank you. So I'm furiously typing notes here, and that's what we used to do when we gathered in the room, and we'd have a bunch of poster boards with sticky notes, but we're doing our best in Jamboard here.
You're doing great. And we're going to open this Jamboard for everybody.
Yeah, so add your stickies later when you get it. It's my new favorite thing. I've never used Jamboard before this event. Christine, how about you? Did you take some notes for us on healthy communities?
Yes, I did. So we had a very small group, but it was great. Everyone was from some place different and had a different type of, was working in a different area. So, and we had one person in our group who was new to Healthy Body, Healthy Minds. And so, you know, it was the first time she learned about some of our pillars and the things that we were doing. So we didn't have a lot of discussion. We did all introduce ourselves and talk about our groups for a moment. The thing I liked best of all was when one of our members said that she thought that Washington County and Healthy Body, Healthy Minds was really being a leader for the rest of the state in so many of the things that we did, and that our organization was well suited to go forward in the pandemic because we had a lot of things in place already, so that when the pandemic hit, we could jump into action in different areas, and we never had to stop our work. And we addressed the pandemic as well as going forward with some of our regular pillars. Then I don't know, the only other thing that relating to Washington County was that our zero suicide, our addressing the issue of suicide has been an important work during the pandemic and not during the pandemic.
Yeah, for sure.
So I think that's it. Hopefully maybe people will want to add other things later on from our group.
Yeah, and you might have been listening in to Susan or listening into Tina earlier, and just, you know, thinking of work that you're doing that you're like, oh, I wish I could tell everybody this. So the Jamboard's a way to do that. I believe there's someone in the email that Susan sent out that will also take comments or notes or ideas in the healthy. Oh, go ahead, Susan. Or Michelle. I heard someone trying to break in. I think the biggest thing that I took away, you know, it was fun. It was fun in our group. We had some new people as well, and there had been offline conversations, and then Terry, Tara, and Summer were in the same room, and they were like, "Oh, I've been wanting to connect with the Charahoe Youth Task Force." So it was great that this event gave them a chance to connect. I think the biggest thing that I heard is a wish for a big running resource list. Like, where do I go for all the things that we are all involved in? And maybe Healthy Bodies, Healthy Minds can put that together. I know we do have a grid of people in different towns and different jobs, but there's so many resources and acronyms, and, you know, kind of a guide to resources is something that we would all love to see come out of this event. So we still have a few minutes. I'll turn it back to Susan and Michelle for a wrap up.
Turn it over to Susan.
Okay, great. Can you hear me?
Yes.
Okay, wonderful. There are some wonderful resources on Our Bodies, Minds that we've put together for COVID and beyond. So I would definitely encourage folks to look there. If there's nothing else that I think we've learned from today, it's that you know, the absolute power of collaboration. And we are so fortunate to have all of you as partners, and just delighted that you're on this journey with us. We're open to feedback, and certainly want you to continue to be involved with us. This work is really takes all of us. There's no one of us that has the answers, and I think that's what's been so exciting about being involved in this work, because what we can accomplish together is truly amazing. And so we've worked really hard to do this work across sectors, and involve folks at every level in every town. And that's what it's going to take to get the kind of community health improvement that we want for everyone in Washington County. And so I thank you for your time and your commitment to healthy bodies, healthy minds, and your time with us this morning. And here's some contact information about us. And with that, I'll give it to Laurel.
Thank you, Susan. And just to reiterate, a thank you to all of you for taking some time to be with us this morning and bringing your ideas, your brain power, your energy, your commitment. A special thanks to the Convening Planning Committee, who worked really hard to pull this together. And I think you did a beautiful job. We're also thankful to our funders who've made this work possible: the Rhode Island Department of Health, the Rhode Island Foundation, SAMHSA, and Blue Cross Blue Shield of Rhode Island. If after today's meeting you would like some more information about any of our particular initiatives or other of our work, don't hesitate to reach out to Susan Orban. She'd be glad to provide you with what you're looking for. And thanks again to everyone for participating today. Have a nice day.
Thanks for your patience with our technical problems too.
Take care.
Bye, everyone.